We're live.
All right, folks, listen, I want to thank all of you for just paying attention to what we do. You know, our D3 movement has a big event coming up. It will really be our biggest live event since COVID. We haven't had a big live event. We had a small live event in April, but we have a big live event coming in November, November 12th. We call it FinFest. Last year it was completely virtual. We had 3,000 people live. We had 180,000 people watch after we finished it. And this year we expect to do better than that. And one of the key features of FinFest this year is a job fair. And so I've got our biggest employer, in fact, the largest employer in New Jersey. It's going to be a part of this job fair. And I wanted to not only promote the fact that they're going to be there, but I wanted you to understand the character of the company called RWJ Barnabas Health, because this job fair functions within the context of our efforts to help close the wealth gap. So I want to welcome Deanna Minus Vincent, who is in charge of the Ending Racism efforts at RWJ Barnabas, which is unique unto itself. And then Mary Dino, who is now in charge of human resources at RWJ Barnabas and is responsible for their participation in the job fair. So, ladies, thank you for spending a few minutes with me tonight. And hopefully, this presentation will help people understand more about RW Barnabas and the FinFest event on November 12th at Kane University in Union, New Jersey. So, Deanna, I mentioned your role ending racism, and there are very few people in this country who have full-time jobs as you do as a corporate executive focused explicitly on ending racism. How are things going with your work at ending racism at RWJ Barnabas?
We are definitely making progress thanks to you and our board members, our leadership. We are moving slowly but surely. My dad jokes with me every week, "Have you ended racism yet?" And I'm like, "Not quite yet, but incremental steps." So, as you know, Dr. Sories, we have four goals around ending racism. The first is around our patients, the second around our workforce, the third is around our communities, and the fourth is around our operations. And we have measurable goals and objectives to get us there. And every quarter, we come together as a leadership team. We identify where we've gone, what steps we've taken to get there for all of our hospitals, all of our departments. And it's slow and steady work. And while I'm not a patient person, we know that systemic racism has existed in this country for 400 plus years. So we're not going to fix it overnight. But
Yeah.
we've definitely done things such as increased the number of people from minority communities in leadership. We have looked at how we treat our patients. We have looked at how we report out. We have looked at cleaning our data. We have looked at how we contract with vendors and making sure that if we're an anti-racist organization, we also want to work with other anti-racist organizations or people who believe in equity. So we've taken progressive steps.
Well, you know what's interesting in healthcare, especially, whenever I go to the doctor, I had trouble with my eye recently, and I went to an eye doctor. And before the doctor would see me, I had to answer 3 pages of questions about my medical history and my family's medical history. And every time you go for some kind of health treatment, that's the case. You can't get a prescription to solve a problem in the future without really probing deeply into your past history. A lot of people want to fix the social problems, the wealth gap, and other social dynamics in this country without considering our history. And what I love about your work is that you're not accusing individuals of being racist. What you're acknowledging is that the history of this country requires an acknowledgement of the systemic racism, the racism that does not necessarily require an individual to be racist. And so it's just marvelous. And I just respect you highly. The work is very hard. And to your point, it's not going to end in a day. Now, one more question before I go to Mary, because you mentioned the word equity. And I'm a preacher. I'm not a professional practitioner, executive type. And so when I talk about equity, I have to distinguish between equity and equality. Because listen, for most of our lives, we've talked about equality, equality between men and women in terms of pay, equality between certain minority groups and majority groups. How do you define equity?
Equity means giving everyone what they need when they need it, in my estimation, so that we can get to the same point. And to put it in, to use an example, if we all wanted to get to, if we all needed $20 to get into a party or into an event, and you had $10 already, and I had $5, and Mary owed someone $2, then if someone came along to give us $5, Reverend Silvers, you'd be at 15, I'd be at 10, and Mary would still only have three.
Right.
So none of us could get into the event, but we would still be behind. So we would need someone to come along and give Mary $22, me $15, and you $10.
Right.
And while they're not giving us equal amounts, they're giving us what we need to get in the door.
That's
And that's what we're
equity.
trying to do for people.
And folks, that's why the work that Mary and Deanna lead is really generally described as diversity, inclusion, but equity. Equity suggests that equality does not necessarily end up with equal outcomes. And we're not guaranteeing anyone equal outcomes, but we are guaranteeing people access to the help they need to get where they have a right to go and the potential to go. So, Mary, how does all of this translate into employment? RWJ is the largest employer in New Jersey, and you're coming to the job fair because, in my mind, Deanna's work is creating opportunities for people, but it doesn't matter how anti-racist an organization is if people don't take advantage of the opportunities that are being created.
That's correct, Reverend Saris, and thank you for the opportunity to be here. I can't imagine doing the work I do in being a resource to humans. I wasn't born into the human resources world. This is actually my second career, and I take very seriously, very passionately the fact that it's that basic. We are here to be a resource to humans. And, Deanna has been an incredible partner to lock arms with across the organization to say, we're going to do this a little bit differently. When I think of equity and the consistency in which we need to not only present ourselves but make ourselves available to those in our community that are coming in the doors to either receive healthcare for their families, or seek an opportunity to become part of the RWJ Barnabas family. And so when I think of the work that we are doing to create diversity, equity, inclusion, and I'm going to add one more word, and it's belonging. Belonging
Right.
is so incredibly important to people to feel special about being called by their name, by saying, hi, how are you, what interests you, in the work that we do here, what are you passionate about, what gets you up in the morning. Because if somebody can show up to the event that we're going to be at on November 12th and tell me what they're passionate about, well, then I can help meet them where they're at and make a match. And
Wow.
so I loved the example, Deanna gave. And I want to complement that with, it is our mission to meet people where they're at. And that's with employment opportunity. That's, for the employees that haven't met yet, for the employees who are already here, and how we're going to develop them to reach their fullest potential individually and professionally.
So, what kind of people should come on November 12th to Kane University and talk to people about employment? I mean, first of all, we're a healthcare network, which means that if you're a doctor, certainly there are jobs for you and nurses, but healthcare is more than doctors and nurses. So, what other kinds of opportunities? What examples can you give for people who are not doctors, not nurses, and they don't want to be doctors and nurses, but you've got jobs far beyond the clinical uh, and medical fields? What kind of opportunities should people look for?
Well, I'm going to talk specifically about that. But before I do, I'll be real clear. I'm looking for smart, trainable people with a passion for the mission of serving others. I would have loved to have been a nurse or a clinician, but I don't like blood, so that wasn't going to work for me. So there's not a clinical bone in my body, but it's people who are intellectually curious to learn, to grow, to invest in themselves, and to be open to the investment that we want to make in them as well. To that critical discussion and to the dialogue of being open to something that they may not even thought about before, because we don't know what we don't know. I didn't know anything about human resources when I went to college. I was a philosophy major with a double minor in music and religion. I mean, I had no idea what I was going to do when I came out of college. And, you know, if people are willing to show up and have a conversation, I think we can find some interesting matches. But we have jobs in marketing, we have jobs in communications, we have jobs in patient access, registrars, people who are interfacing with family members and patients, and being that welcome when they walk in the door to say, we're here for you, we care for you, what's going on, what's your history, how can we help you, we need to know this so that we can better care for your needs. So jobs certainly in finance, jobs in foundation, meaning, how do we find state and federal monies
Hmm.
or philanthropists who are willing to provide, whether it's money for equipment, money for developing our employee base. There's just so many interesting things that go into healthcare beyond. I could keep going beyond the clinical piece. That I really, really hope that many people show up and ask as many questions as their heart desires around what their passion is,
Sure.
because that's what's going to connect them to the great work that they're going to do that they don't know yet.
Well, and don't forget technology. Um, we've said to people that, and I hope I said the right thing. We've said to people, if you have a job and also want a part-time job, you should come and talk to RWJ Barnabas. I mean, while my mom was in the hospital, Deanna, I bumped into a lot of young people who are there part-time. And sometimes a part-time job in a place like RWJ can turn into a full-time career if you're willing to expand yourself and try something new. So now this is a trick question because I didn't tell I was going to ask it, but we've got speakers helping to motivate people to take control of their finances. We've got professionals that'll sit down with people to help them create financial plans. We even have debt counselors that will be available to help people who are drowning in debt and they don't have a strategy to get out. So what would you say to the existing RWJ Barnabas employees in New Jersey about the opportunities they have to come to the FinFest on November 12th?
They need to go, and they need to go now, because the programming you're offering, I mean, first of all, it is bar none the best out there, and I don't know anyone who does this, that invests in the community and says, we're going to give you free information to help you reach your full potential, your financial well-being, your physical well-being, your mental well-being. Because when you can start taking better control over those aspects of your life, then everything starts to become a little calmer. And
Right,
most of us really are looking for joy and peace. Those two things, right? And they really are attainable. But when all these outside stressors, that feed into our daily life, and they're there every day, all the things we can't control, you're creating a platform for people inside and outside of our organization to make connections and learn, have lesson learns around. Maybe there's just a tip or a nugget that they bring back that just improves their life a little bit. How about that? That's
right,
time well spent.
And if I could just add in, I think it's people, it's employees and people across the spectrum. I mean, as both of you know, I lost my mother in June, and we had to learn real fast. And I think
right,
this goes to the wealth gap. Of course, my parents, they were in retirement. They did well for themselves. They had a will, but we didn't know anything about
right,
setting up a trust for in case my dad has to go into a nursing home and they'll take his, like, we just didn't know. We didn't
right.
know things that people in the majority have known for a long time if in fact we're going to build generational wealth for our children and our children's children. And that's what
Right.
my dad wants to do. So we're learning on the fly in a hurry so that it doesn't stop here and it does, or it doesn't, we don't lose a family asset, you know? So I think that the training and the tips that you give are for across the spectrum, not just for a certain segment of the population. They're for everyone. Everyone can take away nuggets. And I think that's critical.
Financial stress is directly related to our health. And the more stressed we are financially, the more likely it is we're going to have high blood pressure, we're going to have diabetes and other kinds of issues that fall under social determinants of health. And as you said, it goes across the economic spectrum. So, folks, listen, these are two outstanding leaders from the largest employer in New Jersey urging us to take you seriously, and we are taking you seriously and urging you to take us seriously. It's November 12th. Now, if you're outside of New Jersey, there will be an all-day live stream that you can register for. And so you can register for free. Go to dfree.com/finfest. You can participate virtually or live. If you come live, we've got free gifts for you. And if you have a watch party someplace else, like Grand Rapids is having a watch party, Grand Rapids, Michigan, we will send you your free gifts in the mail. So it's November 12th, starting at 9:30 in the morning. We've got speakers, we've got musicians, we've got workshops, we've got a woman speaking about wills and estates, how to protect your wealth. We've got investment advisors. We've got young people helping other young people know how to make money off of music and their lyrics. We've got someone coming to talk about the business of sports and how to make money off of sports if you're not an athlete. So it's an all-day event at Kane University. It's all free. Even the lunch is free. The lunch is being paid for. And all of this is made possible by our friends at Prudential. And Prudential will be there in the house, helping people without any fees understand their finances and their future. So, Deanna, Mary, thank you so much. We're going to make sure people see this video, because if they don't listen to me, they'll certainly listen to you. So thanks and God bless.
Thank
Thank you
you.
so
God bless
much.
you.
All
Take
righty.
care.